off to Senator Burch.
Good morning, everyone. Thank you all for joining us today. I am State Senator Eva Burch, and I represent Legislative District 9, and I'm proud and excited to have the honor of sponsoring Senate Bill 1533. For years, drug companies and middlemen have engaged in aggressive price gouging, raking in massive, record-breaking profits year after year to the detriment of millions of people who need their medications to survive. As a practicing medical provider, I have seen this firsthand, and I know that for many, this is a matter of life and death. As a legislator in a state where over 1 million individuals live with chronic conditions like cancer, clotting disorders, diabetes, and heart disease that require prescription drugs for treatment and management, this kind of legislation has the potential to impact Arizonans in a really meaningful way. More than a quarter of Arizonans reported having stopped taking their prescriptions due to cost alone. This is unacceptable. No one should be forced to choose between essential medications and putting food on the table. As a mother and a healthcare professional, I know that passing this bill will not only lower the cost of living for Arizonans, but will offer so many people the financial security that they have been working towards and that they deserve. The bill does 3 things to put more money back in the pockets of Arizonans. It will require pharmacy benefit managers, or PBMs, to get approval from the Department of Insurance and Financial Institutions Prescription Drug Affordability Division before increasing the cost of any prescription drug beyond the rate of inflation. It will require PBMs to report quarterly on the aggregate amount received through the drug manufacturer rebates and to demonstrate how these savings will be shared with the consumer. PBMs often receive payments from drug manufacturers that offset or eliminate the cost of the drugs that they cover, and they pocket these profits, while patients and insurers see no savings. It will prohibit spread pricing, so PBMs will no longer be able to overcharge insurers for prescription drugs. And finally, it will establish the Prescription Drug Affordability Division at DIFI to enforce these provisions and identify more innovative ways to save Arizonans money on medications. Doesn't matter what your political party or your socioeconomic status is, you deserve to live with dignity, and you deserve to have access to affordable prescription medications. So thank you all for joining us, and I would like to pass it over to Teresa Davidson.